they are professionals, they are experienced to do this injection, they'll be able to,
It might have worked for somebody else and it may not work for somebody else. So I think your experience brings a lot to this field.
Do you think that knowledge is required for the embryologist? It is not about waiting longer. It is about starting stronger, Sindhu.
Ma'am, பஞ்சு மேல பஞ்சு போடுறீங்க மேம். அவங்களுக்கு அமேசான்லேயே ஹார்மோன்ஸ்லாம் கிடைக்குதா மேம்? ஸோ do you think she can just do a video consultation, take the hormones and then just come for the procedure?
Despite that, if they want to do self-injections,
Hello everyone, welcome to the Fertility Duo podcast series episode 1. Wow, I'm really excited that this is finally happening. I'm Dr. Sindhuja Srinivasan, embryologist at Sri Chakra Fertility, and I have with me my superstar clinician Dr. Vasundara Jagannathan. Ma'am, why do you think we even came up with this idea of the Fertility Duo podcast?
Fertility Duo actually evolved with the concept of consultation to conception. And to achieve a successful conception or successful treatment outcomes, it is the two great minds, the clinician and the sync between the clinician and the embryologist, which is extremely important to deliver the successful outcome to our patients. And hence we thought that we should discuss how important it is to collaborate and deliver the quality of care to our patients. So I think we should discuss common questions and common queries which we get in our day-to-day practice, so that it can translate into patient outcomes.
That's excellent, ma'am. So I think it's something like what we say, like lab to life, and you've said consultation to conception. So I think we're all aligning in the same place.
Absolutely.
So shall we directly dive into the common questions that we have to address? So ma'am, the most common question that everybody has, even in my mind, is, so for every patient that walks inside Sri Chakra Fertility, do you follow the same protocol? Because we just say IVF, IVF, IVF. So is it the same for everybody? What are your thoughts on this?
If it was that simple, we could just probably copy paste and do the same thing and deliver, give live birth to everybody. The goal might be the same, but the path each patient takes is entirely different. So I think one size doesn't fit all at all.
That's very well said, ma'am. So do you have certain criteria based on which you choose, as into what protocol? Does it depend on the age of the patient? How do you decide, ma'am?
See, so many parameters are there. For example, as you rightly said, age is one very, very important parameter to decide whether she's going to be a poor responder. That means age can say that she's going to get into a bracket of decreased ovarian reserve. The ovarian reserve markers like AMH, her antral follicle count, even as simple as their hormonal status like thyroid or any glycemic control like diabetes or lifestyle factors. So many factors are important to decide on what protocols to choose. Again, very important is patient safety, do no harm. So there are some protocols which is not suitable for a certain patient. So we have to individualize protocols.
So I'm sure that takes years of experience to tailor make a protocol according to each patient. So it's definitely not one size fits all, like you said.
Absolutely. See, IVF treatment is definitely a science. I would look at it like this. It is both science and an art. Science gives us you a framework. For example, you have various protocols, the antagonist protocol, the agonist protocol, mild protocols, or progesterone primed ovarian protocols. So many protocols are there. But then which protocol suits which patients is purely a blend of experience as well, and the years of patient care, and a single patient may not respond similarly to all treatments. So we need to kind of blend both science and experience while choosing a protocol for a patient.
That's very interesting, the way you combine science and art together. So just a curious question. So for the same patient, if something doesn't work one time, will you try other things the next time, or are you going to keep trying the same protocol?
So this is a wonderful question again. Probably I would have tailored this protocol well in advance, and unfortunately that protocol did not work. Then there could be so many other factors why it didn't work. It is not just the protocol alone. There are so many factors. The timing of injections, or whether the patient followed my instructions correctly, the lab parameters, so on and so forth. So we need to troubleshoot at all levels to decide whether I would going to choose the same protocol again or I'm going to change the subsequent cycle.
Exactly. This is why I wanted to know, because I know you make the protocol the first time, but it may not always work, and patients should also understand that, because it might have worked for somebody else and it may not work for somebody else. So I think your experience brings a lot to this field. So thank you for that question.
I think, Sindhuja, from the embryology lab point of view, aren't you, little concerned about what medications we are giving or what kind of protocols are we using? Do you think that knowledge is required for the embryologists?
Absolutely, ma'am. So I think we have all evolved in such a way that right from the day you start the stimulation for a patient, or when we come to know that you're going to do a stimulation for a patient, we go through the entire history and see what she has gone through previously, and if there's any alteration that is required from the lab side, we make it well in advance, and we make sure all the things that we need for any advanced procedure is available well in advance, so that we don't miss out on whatever that has not been done the previous time.
Yeah, so you were asking me, like, what if things really didn't go in our favor in the first time. So I think we both sit together and discuss the patient profile. For example, if we have given a particular trigger this time, there are always a question from your end whether could we use any different kind of trigger next time to have more maturity.
Exactly.
Like we always discuss how many mature eggs. For us, it's not the numbers, it's about the quality and maturity, right, which you're all more worried about.
Yes, ma'am. So we are always saying more quality than quantity when you give us the oocytes or the eggs.
Yeah. So I think we kind of sit together and discuss all the cases, whether it's like positive or negative, whether it was appropriate for that particular patient. It is very important, and we sit and audit and understand whether we are giving the right outcomes to our patients. And it's not only discussion between me and Dr. Sindhuja, it's also the patient involvement and couples involvement as well. So we sit and transparently tell them what exactly has happened and what is the expected outcomes. I think that gives them a lot of strength to go through the cycle.
Absolutely, and I think a very beautiful thing that you do is keeping the patient informed well in advance as what to expect before they start the cycle and through the cycle. I think you're keeping them very well informed and they know what to expect.
Exactly. So personalized IVF protocol definitely changes your standard practice into a success story.
Wow, sama punch dialogue, ma'am. So we just discussed about how one size doesn't fit all. Ma'am, actually, one of my friends called me. She lives in the US actually. Next month varan sonanga. Avangalukku 1 month leave irukam. And she has decided she's going for IVF. So I think she's landing on the 15th நினைக்கிறேன். வந்துட்டு ஒரு 1 month இருக்க முடியும்னு சொன்னாங்க. அதுக்குள்ள IVF பண்ணி pregnant ஆகி கிளம்பலாமான்னு கேட்டாங்க. So I know the question is a bit tricky. So that brings me to the next question. How long do you think it will take for us to decide இவங்களுக்கு IVF பண்ணலாம், இவங்களுக்கு பண்ண வேண்டாம்? And once you start the process, how long do you think the treatment is going to take, ma'am?
See, they're all ready, they're all charged. Your friend is all set, she's made plans. Abna, she's like kind of well read about the process. She thinks like probably 10 days of injections, another 5 days of embryo development, and then after that she can fly back and later come for an embryo transfer. I think ஒரு plan அவங்களே பண்ணிட்டாங்க.
கண்டிப்பா மேம், ChatGPT இருக்கு, Perplexity இருக்கு, Google
so many things are there now available. But if it was that simple, I think we should just give a food for thought. Preparedness for the IVF cycle is very important. Whether they are coming on a short holiday from abroad, why are they coming actually? They want to have a baby. So sometimes it is not the cost which they are thinking. See, your friend might be prepared, they might be saying, okay, I'm prepared financially, I want to do this. But at the end of the day, a lot of counseling is required, a lot of understanding about why they are doing the IVF is required. Setting some realistic expectations to the couple is very, very important. Because I would say, Sindhu, IVF is a very personal journey, emotional journey. It is definitely a psychologically taxing journey for the couple. So I would say wait period is not a standard thing for everybody. For some it may be just the immediate next cycle, there is no wait period at all. For some it definitely warrants waiting. Now why this waiting is required? Because we need to optimize certain things before we go in for the actual IVF cycle itself. As I mentioned that generally the IVF cycle is like involving 10 days of injections, then an anesthesia for egg retrieval and 3 to 5 days of embryo development in the lab. But if it was that simple, then everybody should be having a take home baby rate of 100%. So we need to understand there is something called as pre-treatment counseling, during treatment counseling and after treatment counseling. So wait period அப்படின்றது வந்து ரொம்ப emotionally எடுக்க கூடாது. We should embark this journey in a very stronger way. And pre-treatment counselingல என்ன நடக்கும் அப்படின்னா பேஷண்ட்டோட ப்ரொஃபைல் என்ன, எதனால அவங்க ஐவிஎஃப் போகிறாங்க, இஸ் தேர் an indication, sperm factor எல்லாம் எப்படி இருக்குது, what things we need to optimize, as simple as stopping smoking or trying to lose weight, இதெல்லாம் கூட அட்ரெஸ் பண்ணி, and we need to give adequate psychological support. Is there any other stresses that's there that's going to reduce their chances of success rates? And more importantly, financial freedom and financial counseling, because in Indian scenario there is no insurance that is covering end to end India. So adala it is like a lot of financial pressure on the families who are coming for IVF treatment. So ellarkume vandu the wait period is not the same endra edunala appadina financial independence is not there in our community. They need to probably arrange for finances to go for fertility treatment itself. So again, if you look at it, there is lot of fertility centers, there is lot of comparison of costs among fertility centers. So we kind of tell them what we do better and why our standards are at par with the world standards. We may not be able to give 100% success rate to everybody. See, adu vandu it's not possible. Ulagalavliye 100% success rate nu sonnona adu it's not true. So we try to tell them what are your individualized chances. Suppose severe male factor irundha nama enna pannanom, adukku munnadiye we have a close discussion with the couple. Entire IVF process we show them images, we show them videos, எப்படி இருக்கும் அந்த ப்ராசஸ்ன்றதை we will tell. அது பேஸ் பண்ணி தான் we decide who has to wait longer, who has to wait shorter. So the decision is totally different.
Absolutely. And I think this also highlights the fact that you make a conscious effort in the pre-treatment phase. I'm saying நீங்கள் இப்போ சொன்னோன்னே எனக்கு ஞாபகம் வருது that I noticed that you send every patient to our in-house counselor and our in-house dietitian, and I think how they take the thing also decides how soon they can start the treatment. Illa ma'am, what do you think?
Yeah, absolutely. So sometimes வந்து என்னோட IVF process இப்படி இருக்கும், இதுதான் உங்களுக்கு protocol யூஸ் பண்ணுறோம் அப்படின்றபோது இந்த ஃபஸ்ட்டு கவுன்சிலிங் விசிட் வந்து இட்ஸ் வெரி ஓவர்வெல்மிங். ரொம்ப சயின்டிஃபிக் நாலேஜ் இருந்தாலும் இட் இஸ் டூ மச் அண்ட் தே திங்க் த டாக்டர் எனக்கு ஐவிஎஃப் தான் பண்ணணும், எனக்கு நீங்கள் என்ன பண்ணுறீங்களோ பண்ணுங்கள், அந்த மாதிரி ஒரு ஃபீலிங் எனக்கு கிடைக்கும். பட் ஐ வில் சே நோ, காம் டவுன், ஐ டோன்ட் மைண்ட் கிவிங் half an hour டைம், ப்ளீஸ் அண்டர்ஸ்டாண்ட் வாட் இட் இஸ், யூ நீட் டு அண்டர்ஸ்டாண்ட், தென் only you will take this stress free. ஸோ அதே சமயம் சைக்கலாஜிக்கல் கவுன்சிலிங் அண்ட் டயட் கவுன்சிலிங் we handhold them throughout this process. So they take personal interest. After the first session, the team actually goes to the couple, make sure that they are following the instructions given to them, and many of them they have told me that it has really benefited them through this process. During treatment in a counseling na, again and again we call them, this is the number of injections that you need to take, இன்னைக்கு ஸ்கேனில் வந்து the ரெஸ்பான்ஸ் நல்லா இருக்குது, இந்த டோசேஜ் அட்ஜஸ்ட்மெண்ட் இப்போ பண்ண வேண்டியிருக்கு, இந்த ஃபாலிகல்ஸ் வந்து இன்னும் கொஞ்சம் கூட பெட்டராக க்ரோ ஆகிறதுக்கு we need to change the medication, உங்கள் ஹார்மோன்ஸ் இப்படி ப்ராக்ரஸ் ஆகிட்டுருக்கு அப்படின்றத we call the couple once in 3-4 days during the treatment process also. And I think you also talk to them post egg retrieval, right, to the couple, and discuss certain critical things to them, right? So what exactly you do?
Yes ma'am. So இப்போ I think IVF பண்ணிட்டு போனோடனே the patients feel like ஒரு எக்ஸாம் எழுதிட்டு போன மாதிரி அடுத்த நாள் ரிசல்ட் என்ன even though it is not the pregnancy result, they feel like their children are literally there in the IVF lab and they want to know என்ன நடந்திருக்கு, இவ்வளோ எக்ஸ் வந்துச்சு, என்ன ஆச்சுன்ட்டு. So I think you've started and we are following a very good practice of so இன்னைக்கு egg retrieval நடந்துச்சுன்னா the very next day we inform the patient about இத்தனை வந்த எக்ஸில் எத்தனை ஃபர்டிலைஸ் ஆகிருக்கு அண்ட் அதுலேருந்து எவ்வளோ ஸ்கோப் இருக்குது அது ஃபர்தர் டெவலப்மெண்ட் ஆகிறதுக்குன்னு we inform the patient on day 1, and then on day 3 we inform them about எத்தனை ஆக்சுவலி அந்த ஃபர்டிலைஸ் ஆனது வந்து எவ்வளோ க்ளீவாக இருக்குது, எத்தனை எம்ப்ரியோஸ் இருக்குன்றதும் we inform the patient. And on day 3 we also take an informed decision about இதை நம்ம ஃபர்தராக கல்ச்சர் பண்ண போகிறோமா based on all their previous history and the discussions with you and the patient. And finally on day 5 we inform them எவ்வளோ embryos இருக்கு, எவ்வளோ freeze பண்ண போகிறோம், அதில் அவங்களுக்கு எவ்வளோ success chances இருக்கு. So all these things we are constantly in touch with the patient, and as a team I think we are keeping the patient well informed. And
absolutely, because as I mentioned, pre-treatment we talk to them about day 3 stage embryo. Day 5 now we'll get a 50 to 60% success rate. The quality இப்படி இருக்கணும், good grade, good morphology இருந்தா இந்த success rate. But then the scenario totally changes after egg retrieval, right? So we need to tell them that IVF definitely is like an exam. So after the egg is retrieved, you observe under the microscope and you tell me that this many looks mature, இது M2 site, இது inject பண்ண உடனே so many were good, and 16 to 18 hours you're looking at the fertilization. It's an amazing science that meticulously I think you people work day in and day out. You work on those critical timelines on the embryos, so that is extremely important information we give to the patient. And day 3 la again couple கூப்பிட்டு அவங்களுக்கு whatever images you have captured under the microscope and whatever grading, people are very well ready. இப்போ எல்லாருமே எங்கிட்டே கேட்குறாங்க என்ன கிரேடு, எவ்வளோ எம்ப்ரியோ வந்திருக்கு. So I feel that is very good. Patient interaction and patient participation in the journey, I feel very good. When they ask me, I'm all the more motivated and responsible to answer their queries. So in the madri during treatment phase idella, then as you said, day 3 la embryo freeze panna poroma, day 5 la freeze panna poroma. So it is a decision between me as a clinician, you as an embryologist, and the couple. So I think it is a very important message to everybody that it is only a combined decision. So sometimes couple tell me, doctor எனக்கு I'm not willing for no embryo for transfer. Suppose ஒரு 3 embryo தான் இருக்கு day 3 stageல, நான் என்னதான் day 5 stageக்கு better success rate னு சொன்னாலும் couple will tell me, doctor at least 2 embryo அது day 3 freeze பண்ணிட்டு ஒன்னு வளருதான்னு பார்க்கலாமா அப்படி. So it is like we take every point very seriously, again come back to you and then make that decision for the couple.
So I think this is not just taking decisions randomly. Everything is scientifically based. Absolutely. And there are international guidelines that we follow, and we give them the transparent percentage of idilarundu idu varathukku idudhaan percentage. It's taking a risk is good sometimes, taking a risk is good and bad sometimes. So it's a calculated risk that we are always taking.
Absolutely. So post treatment again, we are with them. So once the embryos are frozen, again the decision between fresh embryo transfer and frozen embryo transfer is made prior itself. So suppose most of them, if we are doing frozen embryo transfer, then again whether we need to do the embryo transfer next cycle. Then the question is, when the embryo incubator la irukna, doctor எப்போ டாக்டர் நாங்க pregnant ஆவோம், அந்த மாதிரி ஒரு இது வந்துருது. Next to the hope level அப்படியே இதுவாயிடும். So அதனால
whatever counseling you have done so far will come to a pause at that time, and then all the recounseling has to start.
Absolutely. So அதனால it is, I will say that it doesn't stop anywhere. So even pre-treatment, treatment, post-treatment, even after a successful pregnancy ஆனதுக்கு அப்புறம் கூட the entire 9 months, it's a full journey with them. So and even if suppose the treatment doesn't work, when we are ஃபுல்லாக அவங்களோட ஹேண்ட் ஹோல்ட் பண்ணிட்டு வரும்போது the acceptance and to proceed with the next step is definitely easier for them because they understand.
So ma'am, I think எக்ஸாஸ்டிவாக பேசிட்டோம். நம்ம 2 பேருக்கும் பேச ஆரம்பிச்சா I think it just keeps going on and on. Now just tell me in one line, இப்போது ஒரு பேஷண்ட்டுக்கு நிஜமாவே எவ்வளோ டைம் ஆகும் to start the treatment and complete the treatment and to get pregnant?
Beautifully said. It is not about waiting longer. It is about starting stronger, Sindhu.
Ma'am, punch podringa ma'am. Okay ma'am, so another question my friend was asking that I just told about la ma'am, in the US la irundhu vara friend, she was saying actually pesama yen na varathukku munadi or video consultation pandra ma'am kuda, and I said that's definitely possible, please tell me what you think about it. And she was saying na video consultation பண்ணிட்டு அவங்களுக்கு அமேசான்லேயே ஹார்மோன்ஸ்லாம் கிடைக்குதா மேம். ஸோ do you think she can just do a video consultation, take the hormones and then just come for the procedure?
It sounds very easy and practical, no? Actually, video consultation is definitely an option, not only for people from US. I also do for video consultations even in and around Chennai, even interiors of Chennai. That's not a problem at all. Buying hormonal medications in Amazon and to save time, do self injections, it's actually not recommended. I will tell you why. there is something called as WHO GMP certified batches, which we procure and then store in our pharmacy refrigerator, which is going to give you a consistent outcome for the patient. Now in Amazon or any online portal, leave alone your friend purchasing it in US, இங்கே வந்து பேஷண்ட்ஸ் எங்கிட்ட கேட்குறாங்க, நான் நிறையா ஆன்லைன் ஃபார்மா இது இருக்குது, எனக்கு வந்து ஆல்ரெடி ஐவிஎஃப் இவ்வளோ காஸ்ட்லியாக இருக்குது, ஸோ கொஞ்சம் எனக்கு டிஸ்கவுண்ட்ஸ் இருந்தால் நல்லா தானே இருக்கும் மேம், நாங்கள் வாங்குகிறோம் அப்படின்னு சொல்லுவாங்க. ஸோ தென் இட் இஸ் மை டியூட்டி டு சென்சிட்டைஸ் தெம் அபவுட் திஸ். ஸோ இஃப் யூ லுக் அட் WHO GMP certified batches அப்படின்னா அது வந்து இட் இஸ் certified by an authenticated body and those batches are given to us and we ensure அந்த batch தான் நான் வந்து என்னோட பேஷண்ட்ஸ்க்கு யூஸ் பண்ணுறேன்றது. இந்த ஷூரிட்டி வந்து ஆன்லைனில் பேஷண்ட்ஸாக வாங்கினாங்கன்னா that surety will not be there. Second ரொம்ப important thing is the cold chain storage of these hormone injections. The hormone injections are extremely sensitive to temperature and the 2 to 8 degrees maintenance ன்றது வந்து important. இப்போ பேஷண்ட்ஸ் கேட்கலாம், என்ன ஹவுஸ் ஹோல்ட் ரெஃப்ரிஜரேட்டர்லையும் தான் இருக்குது, 2 to 8 degrees தானே அப்படின்னா, household refrigerator you stock your food, you stock your everything possible, keep opening the doors and sometimes you put the injections in the fridge door opening and closing itself is so much of temperature fluctuation. But at Sri Chakra Fertility we have pharmacy grade refrigerator in the pharmacy. It is not like a domestic refrigerator. So for example when we do regular audits, அப்போது எனக்கு வேணும்னா நான் லாஸ்ட் 1 month-ஆக வந்து எப்படி இந்த டெம்பரேச்சர் இருந்தது அப்படின்ற ஒரு லாக் என்னால் இந்த ஃபார்மசி கிரேட் ரெஃப்ரிஜரேட்டர்லேருந்து ஐ கேன் டேக் அவுட் அண்ட் ஐ கேன் see whether I have given optimal care for my patients. Extremely important. அதே மாதிரி I was telling you about this WHO GMP certified batches. So from the trusted distributor-லேருந்து எங்களோட ஃபார்மசிக்கு வருது, I can track it with data loggers. They give me how this medications is shipped and how the temperature control has been maintained. நாங்கள் இந்த certification எங்களோட distributors கிட்டேருந்து வாங்குறோம். So much effort we take to ensure that the quality of product, appropriate cold chain maintain ஆகி we are giving the injection. So I would say that please don't purchase these medications online and compromise your care. You might be saving on few thousands, but then it's going to be a very costly affair. Maybe you need to go for another IVF cycle. You need to really think about it.
ஆக்சுவலி நீங்கள் இதை சொல்லும் போது எனக்கு வாட் வாஸ் கோயிங் ஆன் இன் மை மைண்ட் இஸ், இது ஒர்க் ஆகலன்னு எப்படி நம்ம அமேசானில் ரிவ்யூ போட்டால் இட்ஸ் நாட் கோயிங் டு ஹெல்ப் டேக்கிங் சச் பெயின்ஃபுல் இன்ஜெக்ஷன்ஸ் and not seeing the output. So like you said, I think every small thing matters. It's not just about buying something and getting it done by ourselves. And Ingyo, not any nurse cannot do it. Every nurse has to be trained to give hormonal injections. Illa ma'am, what do you think?
Absolutely. So that comes to another common question which patients ask me to save time. Like they see a lot of tutorials in the YouTube and other tutorials and
DIY,
say that DIY. So நானவே injection போட்டுக்கலாமா அப்படின்றது. It's not a bad idea at all. Like there are concepts like IVF at home, like people do injections at home or send the staff nurse to do the injection at home. So many things are coming up. We can adapt to newer technology, but then as you rightly said, when they come to clinic there are certain advantages that has to be highlighted to the patient, and despite that if they want to do self injections we are okay with it. Important things, as you said, the staff nurse giving the injection, they are professionals, they are experienced to do this injection, they'll be able to pick up the right dosage, they'll show you the right route of administration, how much is, whether we need to exactly injection போட்டுட்டு அந்த இடத்துல நல்லா தேய்க்கணுமா கூடாதா, அங்கே ஐஸ் பேக் வைக்கணுமா வேண்டாமா. So many common things, they are extremely trained to do this. So that is one thing. Second thing is sometimes patients are little scared to prick themselves. Sometimes there might be a slight spillover.
So that's another important point la ma'am. The hormonal injection volume is very less, so they might think oru drop da spill aachu, but that might be equivalent to so much that is required for the follicle growth.
So it is not 100 mg or 200 mg. We measure in international units. So a small spill of a few drops might mean that you have completely reduced your dosage to half that day. So I think it is very, very important. And again, as I told you, cold chain in Chennai or Indian scenario, power fluctuations and so many things do happen. So we need to extremely be sensitive of that aspect and decide clinic could be a better place to do injections rather than doing self injections. So the real cost is not the price of the injection, it's definitely the outcome that matters.
Very well said, ma'am. So I think the IVF success depends on your trust, on your doctor, on your embryologist, the lab, and of course, most importantly, your medications. So I think for episode 1 of Fertility Duo, we've come to an end. So looking forward to seeing you all in another episode of Fertility Duo with more interesting questions, because the questions are just endless. I think we will take some time and answer all of them. Bye.